UWITV is pleased to present a two-part forum hosted by the University of the West Indies, Brock University, and the Canada Caribbean Institute entitled Seasonal Farm Workers in Canada During the COVID-19 Pandemic. In part 2, our next two presenters are Dr. Lilith Vassar and Dr. Claudette Crawford Brown, followed by a question and answer session.
I'm now going to ask Professor Vassar, Professor of Biological Science, Faculty of Mathematics and Science, Brock University, and also UNESCO Chair for Community Sustainability, to present on foreign workers, an essential service in the Canadian agricultural sector, and how best to protect them. Professor?
Thank you very much. I would like to again thank the organizer for this very interesting and very important topic, in fact, for all of us. I will try to not repeat too much some of the information of the previous speakers, but I will share a few components that I think would be important. Okay, I will talk about my own work because I work especially with rural communities, and my work is especially in sustainable agriculture. So I work a lot right now at several projects with vineyards in the Niagara regions. So I'm interacting with the seasonal workers on a regular basis, and I know how it works in some cases. So I'll explain a little bit more, and then I'll talk about what Simon has been alluding in terms of their protection and all that. And finally, I'll just give a little bit some avenues of solutions. There was in the chat a question about, is it a blessing, the COVID? Probably in some way, to be able to leverage what have been said by the two previous presenters. So in agriculture, for me, one thing that is very important is its sustainability. I work mainly, I should say, with vineyards that are organic or are based on more environmentally friendly systems. So it may be a little bit different for other type of farming, and that's something that I acknowledge very well. One thing that was said is that it is an essential service. The problem has been that the general population has no idea where their food is coming from. And because of that, and this, especially in Canada, this is getting really, really bad. And they don't understand that they don't know where imports are coming to feed them in the winter. And we know that every country will be at some point in the same boat. So if we don't produce food, there will be a huge problem especially in the coming winter. So that's something that we have to take into consideration. One thing that is important that has been already mentioned is all the challenges, however, that there have been. Challenges that were there before, that is in terms of social justice, in terms of component. In my case, what I'm most worried, because I work with in these fields, is also their protection in terms of environment, in terms of pesticide and all these issues that can have. So this is why working with organic farms, I see a completely different situation, and I see a different ways, in fact, to work with seasonal farmers. During the COVID right now, there are more challenges than before in terms of quarantine, misperceptions, and that's especially true in communities, and misunderstanding of what really is happening. And these are probably frustrating aspects of what's happening right now. So in terms of the environment in vineyards, they are highly skilled workers. Discussing with the managers of these vineyards, it takes years to train the workers to be able to know how to prune, how to remove the buds at the right place, how to demount in the spring, how to mount in the fall around the rootstock. So there are many components that these farmers are amazing. These workers are amazing. And this is why, at least for the vineyards, it's very important and this is why they want to keep the same people, because they know they trust them, and that's the important part. What we have to understand is that not all the farms are the same. Working with vineyards is the way it is. I should say that I've seen, not necessarily in the Niagara region, but in other regions, and more the annual crop, unfortunately, they have been very, I don't like to talk about mistreating, but it's not necessarily the great conditions. So this is why what has been taught with the two previous speakers, there's still a lot of work to do. So that's for sure. Just a couple of quotes from some of the vineyards managers that I work with. And one said directly to me, I treat my worker as though they were part of my family. I should say that they have quite nice accommodation there as well. And this is why she find that insulting sometimes to put a broad stroke on all the farmers. So we have to be very careful. And in our case, because of their training and all that, they have been with her for years, and she's keeping them quite well. Another manager told me that it has happened that he had one of his worker diagnosed with cancer a month after arriving and that was a few years ago. He stayed in Canada for the year and getting chemotherapy and radiation treatments daily for a few months, then surgery, and was not discharged to go back to Jamaica until he was given a clear, all clear. So he was not allowed to return, unfortunately, to Canada to work because of this medical conditions. But while he was here, he had all the normal care that you and I would get. So it's really, again, we have to understand that it really depends on the farmers and who is the employer, and this is why I was thinking about when Tanya was talking about the lack of analysis. I think we need a lot more. And when we talk about is it the blessing, the COVID will probably help to better understand all these conditions that we really need to figure out better. Now I want to talk about the current conditions with COVID-19. I will say, because I've not been allowed to do field work right now, despite all that, and this is the crazy thing, but anyway, that's another issue. But the current conditions with COVID right now is, first of all, is that it's highly regulated. It was first under the public health and the province, and gradually the federal has taken over in terms of how the legislation have to be put. It's still the province that has to implement, and there are many ministries that are involved, including the Ministry of Labor, Training and Skill Development. There are a lot of the public health units are involved. So there are many organizations or agencies that are involved in that. So one thing is that they are very strict this year on that. First of all, they conduct proactive workplace inspections, focusing on the workplace that employ the foreign workers. And also they have to provide education support and compliance assistance to the employer with regard to the Ontario Health and Safety Act and the restriction due to the COVID-19. There are policies and procedure in place to ensure that any worker with symptoms of COVID-19 are not coming to work, but they are still paid. And that's something that sometimes has been also a misunderstanding. This is part of, I receive all the procedure because gradually we hope to go back to the vineyards to be able to do our research. And so we have to follow the same rules as any worker on the land. And so these are two very important points. First, that an employer shall provide information, instruction, and supervision. So the shall is legal to a worker to protect the health and safety of the worker. And the second is an employer shall take every precaution reasonable in the circumstance for the protection of a worker. Now, where it becomes difficult probably, and this is what happened in Green Hill, is that when we talk about greenhouses, the social distancing of 2 meters is way more complicated than if you're in a vineyard, for example. So these are the type of things that makes it more complicated, I would say. And at one point, it's probably a question of looking at the different types, like in Alberta with the outbreak in the beef meat transformation plant. Again, they were in too close contact to each other. So that's also another issue. Employers also have obligation under the Occupational Health and Safety Act, and its regulations is to protect the workers from hazard in the workplace, including infectious diseases. So the physical distancing, limited contact, it's not only in the field, but it's also when they have lunch break, in closed space. Also, they cannot have like what we call the barn teams, so that you know, everybody goes one by row. So that has to change the way that they do it, accessing even the equipment. So the vineyards where I work, they have disinfectant to all the equipment. So if it moves from one person to the other, it has to be disinfected before it goes to the other person. Encourage workers from separate households to travel in different vehicles, for example, and install physical barriers. So these are the type of regulation that has been put in place, especially for me anyway, what I've seen in the vineyards. So really, they are trying to put the intermediate, the foundation, as well as the rationale around that. So they're really trying to support employees, and I'll show you a few other things about mental health, health and safety, to raise awareness, define work plan to address the pandemic. So each farm is supposed to have a plan. So that's something that, again, I think these regular visits right now are certainly helping to see if the plans are there. And I should say one of my vineyard was very clear that they are so scared that they make sure that they have everything prepared so that, because these inspector can come anytime. So that's the other thing. So that helps a little bit to figure out if it's going to happen or not. If they find a worker who has been exposed to COVID at work, or a related claim that has been, it has to be a file first with the WSIB. So this is the Work Insurance Bureau. And they have to notify the Ministry of Labor, Training and Skill Development, and as well as the Health and Safety Committee, or in our case, it's often with also the Public Health Unit that they have to do that. And this is one thing that Simon has mentioned with Green Hill. in many cases, it's not the foreign worker that necessarily will bring the COVID. It may be, and most likely in some cases, people who are already on the farm. So, and I should say that in another farm that happened, it was the daughter of the farmer that brought it. And at that point, everybody, including the family, had to go in quarantine for 14 days. So it's not only the workers, but also the farmer and his family. The planning for the outbreak, at the minimum, they had to provide that they have the capacity and the protocol for isolating symptomatic or confirmed sick individual in separate accommodations. So you can see already that when we say, is it a blessing, and probably will help leverage the needs? In some way, probably, because farmers had to be very careful of having better facilities, accommodations for that part. Written plan and protocol for dealing with all that. So like as I said here, in our case, it's the local public health unit that has to be notified. So that this is the kind of things that they have to prepare. They should also have a plan for anxiety and mental health. And I should say their website, and they are even lines now for people to be able to, for workers to be able to connect if they need. Unfortunately, I will say, if I didn't have the information from my vineyards, it's very hard to find on the web. So this is where also the communication has to be improved to make sure that we really have a better system for them so that they understand what's happening. So in terms of avenue of solution that I see for me, I would say first, ensure that they continue to be protected. The job security, the training, all these things are so important. That has to be continued. Education for seasonal farmers. And I think this is where also probably we need a little bit more, probably a new approach, I would say, that they should be educated not when they arrive here at the farm, but really before even they leave their country. So they understand very well their rights and what they can expect or not. And I should say the fear of deportation, I think is put because of this lack of understanding their rights. And also they have to realize that the farmers don't want too much deportations, because at one point, if they don't have enough employees, they will not be able to farm. They will not be able to produce. So that's something that needs to probably be better understood. Education for community and the media. The media has been very bad in some cases to not, like in the case of Green Hill, to not really put the right thing in the right place. And they don't understand, again, as I said before, the importance of the seasonal farm workers. They have to better understand that. And also they need respect. I should say, I'm so grateful to have them and they are so knowledgeable. People have to understand their importance. The inspections should not stop, and I think this is where we may see improvement, is that these inspections that are done right now because of the COVID-19 should probably not be stopped after, to ensure better safety and better conditions for the workers. Because now the farmers don't have choice to show what they have. So if they were not very compliant before, they have to be now. And that may probably help a little bit to improve their conditions. I think this is where continuing probably to suggest to the government, don't stop now, would be probably a good way to ensure that we start improving on these different aspects. So that was what I wanted to say.
Thank you, Professor. I was happy to hear how much is already in place, although we know that more can be done. I was happy to hear of how much is already in place in terms of regulating the environment in which seasonal migrant workers are employed in the agricultural sector. Our final presentation will be by Professor Dr. Claudette Crawford Brown, and she's going to speak about the psychosocial implications of migrant farm workers in Canada in the context of the COVID-19 pandemic. Dr. Crawford Brown?
I would like to start my presentation by talking about the context within which it has been presented. I am looking at the psychosocial implications of migrant farm workers in the COVID Canada scenario, but I am focusing on what I've called a Caribbean social work response. Now you're seeing your screen that I'm sharing, and you will see a picture of a farmer. Many people will think this is something that's funny, it's amusing, but the reality is that this picture epitomizes the spirit of the Jamaican people. Now, I am going to mention that I am unapologetically looking at this problem from the perspective of the Jamaican responsibility. So I am very, very happy that we have got the context of the Canadian and their responsibility, the things that have been put in place, etc. But I am coming to this issue from the point of view of a social work and its responsibilities for dealing with oppression and for dealing with inequities. I have culled information from Dr. Khadija Williams, who is a member of the social work unit, and I come to you wearing the hat of the Migration Studies Unit, which is part of the Department of Sociology, Psychology, and Social Work. We have an umbrella organization, which is a center for population, community, and social change. And so there's an element, will be an undercurrent of activism in my tone. Now, when we look at the cover photo, you will see I have there, our people, Jamaicans, as you all know, are people who fight against all odds. We little, but we talawa. I'll teach a little bit of Jamaican dialect and patois there, meaning we are small, but we are strong. And I have put another phrase, turn your hand make fashion. This person with his cabbage leaf over his nose may be funny to some, but he's basically trying to exist under all odds and against all odds. And it shows, I think, that our farm workers will do whatever it takes to survive. And so when we look at the next slide, we see that the major assumptions of my presentation speak to the fact that social work responses to this situation must be, have an undercurrent which says that we are here as social practitioners to address social and economic inequities. Farm workers are from the most vulnerable group in our society. These are persons who are in poverty in a lot of circumstances, in a lot of situations. Poverty often leads to desperation, and we know that systemic social and economic inequities create a lack of choice. Desperation, therefore, often leads to giving up one's rights. And I therefore suggest that undergirding my presentation is that the state in the country of origin is responsible for its own citizens. I was so heartened to hear Leah's presentation a while ago where she says education must take place before they leave their country. And the fact is that though they are given options, when you are given options with limited information, very often this can be seen as an oppressive practice. So let us look first at the profile of the Caribbean farm worker. And in looking at this profile, it brings me to my days of living in Connecticut. My interest in this area, as many people know, has to do with my work with Caribbean children and children left behind by those farm workers and the barrel children syndrome. But I actually worked directly with Caribbean farm workers while living for 4 years in Connecticut in the USA. And in that scenario, what we found with those persons who were picking tobacco, they had a certain profile, which is very similar to the profile of the Canadian farm workers. So I have, the slide shows who selects farm work as an occupation and who selects the farm worker. So I'll give you a little bit of the picture from the Jamaican side of the equation. Number one, persons who do a farm work and select farm work as an occupation may have underperformed academically. And checking with the Valley Academy for Agricultural Sciences in St. Anne, I worked with and spoke with Dr. Khadija Williams, who mentions that a lot of the farm workers may not be able to read in some cases. They work very hard though, and so you see me have they come from vulnerable rural communities, and they may have underperformed academically, so their ability to read and write might be limited or not. The fact is though that they have the migrant psyche, which means I must succeed at all costs. You don't leave Jamaica and take up yourself and go on a plane to a foreign country without a resolve that you are going to come back with success. And so they are hardworking because they must. They, on the other hand, though, Prebish, I notice he's cited by other presenters. Simon mentioned him in particular, and I saw his name mentioned again in Talia's presentation, has done a lot of work on labeling and stigmatization of the Jamaican farm worker. And I noticed with a smile that they mentioned that some of the name calling is that Jamaican farm workers are hypersexualized, stealing Canadian women, on top of all of the other things that some of the other presenters mentioned. So I thought that was interesting to just highlight. So they are hardworking, but they're also labeled as being hypersexualized. So there's an article by Satsu Witch, who mentions in the Journal of Caribbean Workers, when he talks about Caribbean workers, where he talks about the fact that in 1974, the reason for the bringing in the Mexicans were that they were looking for this hard-working and flexible population, and it was felt that the Jamaicans were not enough and they needed a more pliable worker. So that's for the sociologists to look about and to think about and to chomp on. The next issue, though, as shown on the slide, is who selects a farm worker. And we must remember that they are chosen by community-based political representatives in their country of origin. So that's very important for us to recognize. And maybe this is why, or we can discuss this later, we don't have the kind of preparation that I'm talking about. So then, what am I suggesting? I'm suggesting that this is a group, they are poor and they are vulnerable and they need protection. It is the responsibility of the state to protect these individuals in their country of origin before they leave, as Leah suggested. And the owner should not be all on advocates in Canada. It should not all be on the farmers there, who obviously these persons are getting benefits. But what about the responsibility of the Jamaican state, the Jamaican practitioners who work directly with these persons, who can prepare culturally appropriate methods for communicating with our workers? Though they are repeat workers, the nature of the process does not guarantee ease of acculturation, particularly within the context of COVID-19. The fact is that they can die. Nobody's talking about that. The fact that there are protections before COVID, but there is a life pre-COVID, and now there is a reality post-COVID, which could include death. Travel to the host country, therefore, at the start of a pandemic that many well-educated global professionals in the medical, legal fields, etc., are just now understanding, is unfair, to put it mildly, to the individual who is desperate, who is poor. So I'm suggesting that, one, workers in poverty in the country of origin, moving to the host country, has to understand the labor practices and culture. This is even without COVID. And there needs to be a thorough orientation to all of what he needs to understand or she needs to understand before they leave. There are limited personal capacities to understand the epidemic, as well as understanding the technology that goes into living in a first world country. All of that should be covered. When they have very, very few choices, when they are told you have to sign this and sign that. They will sign it because they are desperate. So I'm suggesting that in the face of social and economic inequities within the country of origin, the desperation leads to a situation where they will sign anything at all costs. It's the nature of the beast that there is inequity, but putting them in a situation where they have to make a choice like that, I'm suggesting at the least, very least, is grossly unfair and is a sign of an oppressive practice on the part of the country of origin. I'm not dealing with Canada needs to get their food, Canada needs to get their produce for their society, but where is the responsibility of the country of origin in all of this? They are being asked to deal with all of the normal migrant issues and confront the COVID pandemic without family, without community, without state support. If they get very, very ill, they are normally accustomed to working with home remedies. I work right now with a group of social workers, psychosocial support being provided to the families who are who have COVID symptoms in Jamaica right now. And a lot of them are helped by family members using home remedies. We've heard of the stories on Facebook about social interventions and medical interventions and healthcare workers who are on the front line, who have been able to beat COVID-19 because of using home remedies from their home country. Where is that link? And I'm suggesting that the University of the West Indies, through the sociology and psychology students and Karimak and videographers and journalists can help in this regard to be able to connect the farm worker with his family and with his cultural community. I'm suggesting that there's lack of preparation in the country of origin in terms of the basics pre-COVID. So we're talking about climate, psychosocial stigma, the cultural issues. All of those things are there before COVID and should be dealt with as a part of what we do before our migrants leave. So as somebody said, maybe it's a blessing in disguise. We need to rewind and come again about how we let our migrants leave, whether pre-COVID or not. And I suggest that literacy issues are a big problem because we need to talk about lack of preparation. We need protection, the PPEs, the social distancing, all of that. They're very complex issues which we as professionals are grappling with right now in our own families. Why is it that we don't remember that those individuals need help to understand those issues too? And the literacy issues, of course, will come up when the Ministry of Labor will tell us, oh, we gave them brochures. We're gonna need audiovisual information, audiovisual techniques, because many of these persons are not as literate as they should be. So I'm suggesting in the next slide that few Caribbean migrants are prepared for the migrant experiences to the north. And you have here something which I am actually just working on. Precious Goes to Foreign, Precious Leaves Paradise is a children's book on Caribbean migration that I developed because of this problem of people leaving their countries suddenly and having to adjust. Some might know that I am known for the barrel child syndrome, where I talk about the issues that children and families face in the host country, and then what happens to them when they are reunited and they go to the host country and in their current country of origin. I'm suggesting that this kind of information that has been prepared for children, which I've spent a lot of maybe 3 decades working on, needs to be prepared also for the adults and families who are migrating, because those adults and families need preparation too in a pandemic that could end up in the death of their loved one. And they could end up with that death faster, quicker than previous pandemics and previous issues. What are the push factors we see then? And the challenges, they're not one of us. We are here, they are there. We versus them. Inclusion and exclusion issues which often happen are going to happen more when we now have persons who are labeling our migrants as bringing in the disease and as carriers and vectors of the disease. So that is something we're going to have to address, because the reality is that our migrant workers left when Jamaica had no cases of COVID-19, and now we are hearing reports that they've contracted it. So we have to be careful about the kind of literature that's available to our persons for them to know their rights, as well as we need to collaborate with the advocates about what the real situation is. So let us look at a little diagram here, which I have. It's an ideological framework for understanding differences in family structures in the global north and the global south. I think we will understand our farm workers better if we understand that this was developed by Omar Brown in 2018 at a conference which I did in the Netherlands, where we were talking about family issues on migration, where you had Syrian migrants and individuals adjusting to life in Europe. And what we show here in this diagram is that in the Caribbean, in the country of origin, there's a semi-permeable membrane around our families where we walk in and out of our family. So you have individuals outside of the family and inside of the family being able to walk within, into the family and outside of the family very, very easily. And so we have something called, as you see on the slide, auntie or mummy is a word used for people outside of your family, even though they are not your biological mother or your biological auntie. So there's a very strong sense of community. Once the family, the migrant moves now into the host country, you see in the bottom it says in the host country after migration, the individuals within the family are bounced back and kept within the confines of their family. So you have what is called a impermeable membrane. And in the host country, the family boundaries become impermeable and issues of exclusion become cemented into the lifestyle of the migrant. And so the family has to fit into the notion of family is a very defined space, and they're excluded. Though you have that Canadian worker and farmer who Liet spoke about, who says, well, they're like family. The reality is, when it comes to what do I do when my chest is tight? Well, you take a little ginger or you take a little turmeric and you boil it and you drink this and you gargle this, and those kinds of things are not able to be shared because the person is coming from a different kind of family experience. And we see the exclusion of the migrant now coming from a sense of issues of racism and all of those kinds of things that were mentioned earlier. And some of them are very, very lucky. I'm not suggesting that this is happening to everybody, but I'm just talking about the reality of the experience and the differences when one moves. So then, what are the solutions? I'm suggesting that the social work response must come from a macro policy level, and I'm talking about the social work response, remember, here in the Caribbean. Macro policy level, community medicine level, and we have to deal with ameliorating some of the challenges from an individual and a family level. Macro level, social work professionals must be at the policy table. We have to strengthen teaching of international social work courses in the Caribbean so that we are better able to collaborate and talk across borders. We have to create courses where there are using the technology and using the internet-based courses to talk across borders. So a Liet and an advocate here in Jamaica, or the Justice for Migrant Workers advocacy group should be able to link with an advocacy group here in the Caribbean. Why are all the advocacy groups based in Canada? We need advocacy groups here on the ground in the Caribbean. We have to change our pedagogy where we use user participation. It's a method used where the farm workers themselves can talk to people here in the Caribbean about what they experience, and we help to create our teaching modules using the Caribbean farm workers themselves. Another suggestion made by the Valley Academy was for those workers to come back and teach through mentorship rural agricultural workers here in the Caribbean. Some of the new techniques they have learned so that we can better, as you see at the last one, improve our agricultural practice that must make agriculture more attractive for youth in the Caribbean. Why not use those farm workers when they are returning on their hiatus to teach our young farmers the better farming techniques so that we can get to a day where farm workers don't have to sign off their lives to go to foreign or to another country. There's nothing wrong with them going. It's a tremendous opportunity, but we must begin begin to think in terms of sustainability and bringing back some of their expertise here to us in the Caribbean by them training young workers here in agriculture. I'm suggesting that there's need for video and film production in social science curricula to help with that. And I'm talking about, apart from the online teaching, actually creating video-based tools to help us to communicate with our farm workers so that they can have an app on their phone, on their cell phone, which they can use to understand what is COVID, what is social distancing, what are these things that I don't know about, how do I better help myself, what are the home remedies I can use. All of that is easy now with the technology we have. So then, at the community level, community-based film production. 2, research-based psychoeducational interventions. We can't just develop the interventions out of the blue, but they must be evidence-based. There's also a need for collaboration between social workers, CARIMAC workers, journalists, across discipline, this interdisciplinary work. And the Caribbean Canada Institute, I'd like to suggest, is an ideal place to have that kind of sharing. Journalists in Canada, journalists at UWI, Mona, could be talking to each other as students, as mentors, to help us to develop better platforms for our workers to use, which could be easily put into an app or a video in our orientation. Linked to law, economics, the medical people could get in on this. And this would allow our workers to make evidence-based, informed decisions fueled by research. Finally, I'm suggesting that protecting migrant workers must involve family kiosks, cell phones, this is the micro level now. Tablets must be made available, and kiosks, like happens in the Christmas time, greetings from across the world, they must have regular contact with their family. It's not so difficult anymore. Let us set this up so that the farm workers can talk to their family members in their country of origin. You could have even 1 tablet per farm due to the geographic issues that exist in Canada at this time. We in the country of origin, Jamaica, must be responsible to prepare those citizens, our citizens, for the total migration experience, especially the risks in a pandemic. We are not okay to say, okay, go on the plane, sign here, and say they made a choice. That is oppressive. We must help them to make informed decisions. At the final level, I'm suggesting strengthening the use of telecounseling across the borders, using basic telecounseling equipment, a screen, camera, not a lot of money, but some way of developing mechanisms where on a regular basis there's telecounseling with people who speak your language. And I say this because I worked directly with those tobacco workers, and when they saw me, Miss, how do you scratch a card? At the time they didn't have cell phones, and they used to scratch a card and they didn't understand how to punch in the numbers in the stationary phone at the local Stop and Shop. And I was the resident social worker for 4 years while I was doing a visiting professorship. Using telecounseling could make it easier for them to talk to people who can speak their language, understand the patois and the dialect. Next, developing culturally appropriate materials in the form of books as well for the migrating adults. But I'm pushing for the apps and the videos and the easy internet-based applications. And of course, that big issue, collaboration between social workers and advocates in the Caribbean and Canada. I will stop there. My closing remarks is that social policy must mandate adequate preparation protocols at the macro level, at the meso level, and there must be extensive orientation for the migrant's children, the migrant's family, to address the cultural, social, and medical health issues that are going to come out of the pandemic. And I'm suggesting that we do this with the notion that this COVID-19 is not an easy pill to swallow, and we have to think in terms of preparing children and families and spouses and baby mothers, etc., for the fact that their relative may not return. And those realities, I don't think, are clear in the minds of our migrant workers, and we have put them into a shark-infested water as Caribbean people without the necessary preparation. So I thank you all, and I'm looking forward to some kind of discussion.
All right, well, let me begin by thanking all the presenters and to say that we have about 20 minutes for questions, and I have a number of questions. The first one is really a clarification, a request for Dr. Crawford Brown to clarify or explain the term barrel children.
Certainly. Barrel children, as defined by me, the person who coined the term, are children waiting to rejoin their parents in the metropolitan north, whether it be a farm worker or it be a mommy working with a nursing aide to a family in the US, Canada, or in England. They receive material goods in barrels or corrugated barrels, which is simply the mechanism by which the packers send these materials to the Caribbean. But the difference about just this, not just sending, these children receive the material goods, but they lack the emotional nurturance that they need. So it's an arrangement that's often made where children are left with relatives or whoever. They receive all of these material goods, pretty done, pretty dress, pretty shoes, pretty sneakers, etc. But they tend to lack the emotional nurturance that they need. So they are children of migration with that clause. And it's not every barrel child who is a child of migration. It's not every child of migration is a barrel child. It's those who have difficulties because of the absence of parents. They have a new family, they go as a farm worker, they get married, they leave their family behind, and they suffer emotional and behavioral problems as a result of that.
Thank you. We have another question, which is for all the panel. And that question is the situation with COVID-19 an opportunity to address some of the issues which all the presenters have raised as ways of providing a better working environment and better benefits for the migrant workers? Anyone can start.
Okay, I'll answer quickly. And from my point of view, I think that COVID-19 does present such an opportunity. I am suggesting that since it's here and everybody's focused on it, why not use our university, the University of the West Indies, I'm pointing to, and I'm putting them on the spot for this, to pull together multidisciplinary courses or a course which would produce the kinds of audiovisual aids that could be used for orienting and teaching the migrant farm workers about the disease and their rights. All of that can be done these days using the technology, and that is one of the things. And the telecounseling I'm suggesting is the next important tool that could be used to directly connect the farm workers with people who speak their language. I am suggesting that the University of the West Indies has a psychology and sociology department where we have students who do internships, and so it's not something that could be expensive, but we could pull together the necessary stakeholders in our societies to be better able to answer the questions and deal and ameliorate some of the challenges that our migrant workers are facing. And this can be done through linking with advocates on the ground in Canada. All of that can be done. But I think Jamaica and the Caribbean has been left out of the solutions in terms of helping our own people, and it's our responsibility to do so.
Thank you. I would like to invite some of our comments from our Canadian colleagues. They are operating in the political milieu of Canada. Is this an opportunity to address some of the issues that were raised?
I think it is in some way, because as I said earlier, the fact that, for example, they have a little bit more the possibility to, they have more people going in the farms to check on them and all that. I think in some way there's kind of a better understanding of what can happen. And if they get more and more educated as well, like Claudette was mentioning, I think these are kind of things that can help in terms of pushing a little bit further to make sure that their conditions especially are better and can be done correctly. At the same time, we have to remember, I know that some were asking for increase in salaries, for example, and things like that. It all depends again of the type of farmings. I should say most of our vineyards here do not make a lot of money. In fact, often they don't survive from money, especially because of last year. Last year they lost a lot. So in many cases, they don't make enough to even be sustainable themselves. This is why most of them, in fact, have another job. Several of them are Prophet Brock, in fact. These are the things we have to also understand, that unless, and this is again because of our current system, agricultural system in the world, that includes a lot of subsidies and things like that, people do not pay the right price for food. If we were to pay, and in fact, Mark Carney, a former Canada, Bank of Canada president, just had a op-ed in The Economist this week, and showing that one thing that COVID-19 may do is showing the real price of things. And food, we don't pay the real price, and therefore people don't understand how farmers and farming workers are struggling. And that's the problem. It's because we don't know how, I should say I grew up on a farm, so it doesn't help. I should say that it's a very tough job. And this is why, in fact, in Quebec, they know very well that no Quebecers will do it. This is something that they need to better understand. Until people understand that, it will always be difficult, because you cannot increase price because people don't want to pay more in the food. So that's, this is the balance and things that we have to start rethinking. We need to rethink our current system. That's pretty much it.
So, Liet, are you saying that the pandemic would help the Canadian society to better understand the importance of our migrant workers and their role in farming, and how the costs and why they're important?
Yes, and also the importance of farming, period. Okay. The food production in the world is undervalued by people, because they go in the store, they can buy everything and relatively cheap. They think everything is free. It's almost like we missed the understanding that the importance of food and the price, the real price of food. That's the big challenge right now.
Thank you. There's another question here, which was raised in regard to those workers that have to go into quarantine. Will they be paid while they're in quarantine, and how many hours will they be paid per week? I think there's a minimum number of hours that they have to be paid for.
Yes, they are paid, and they are paid like if they were doing the normal weeks that they are supposed to work. So yes, they were paid.
Another question is does the fact that some workers who came from the Caribbean, particularly Jamaica, and became infected when they got to Canada, will this put a stop to further workers coming to Canada this year?
I don't think so. It will depend on the quarantine issue, the number of workers that are allowed per farm. You have to remember that we have also the social distancing and all that. So there are a certain limit of number of people for now. That may change over time. So that's something that is not clear yet.
Another question that was raised is the fact that workers who have been coming to Canada for many years seem to have been paying into certain social security systems? And if they chose not to come back or not to come this year, would they be able to draw any benefits from the social schemes that they have been contributing to over many years?
Dr. Bernal, it was just on the question of whether the pandemic, and I'm cautious of my use of words here, as an opportunity given the devastating impact in terms of loss of life that it's having, particularly on racialized populations, both in the global south and the global north. But whether the pandemic can be a moment of crisis in which organizations, migrant workers, can advance migrant worker justice. I think the answer to that is yes, but there are a note of caution, I think, that I would like to bring into that conversation. And since the start of the COVID-19 outbreak in Ontario, Canadian workers and permanent residents in Canada who fear contracting the virus have filed more than 200 or around 200 work refusals. So in Ontario, under the Employment Standards Act and Occupational Health and Safety Act, workers have a right to refuse unsafe work. The Ontario Ministry of Labour has not upheld a single one of those work refusals. And this is amongst a population of workers, permanent residents, and citizens who have much greater power on the job than migrant farm workers in the SOP and the Seasonal Agricultural Worker Program do. So I think there are, this moment of crisis allows us to reflect on the importance of migrant farm workers to the Canadian economy. But the advancing of migrant farm workers' rights will only happen really through a strong advocacy and organizing, both as was mentioned, both in Jamaica, pushing for changes to the relationship to how the program is implemented and upheld in Canada and in Canada itself.
Thank you. I'll just interject this bit of information which was sent in by a listener, which is that the province of New Brunswick apparently has banned further migrant workers for this year. I just enter that piece of information. I have another question, which the person who submitted it has asked for Dr. Black and Professor Vassar to comment on this, which is, what can be done to reduce the racial hostility which migrant workers have experienced?
If I might address that, it's an excellent question. And we know through kind of qualitative research that migrant workers, both from the Caribbean and from Mexico, experience racism both on farms and in the broader community. There was an article in a local newspaper, Niagara-on-the-Lake newspaper, which reported that migrant farm workers were being refused entry in a number of stores in the downtown core. So in effect, migrant farm workers are being racially profiled in that community. And this is not the first instance of racial profiling. There were efforts by the town of Leamington, in which migrant farm workers there are essential to the tomato crop harvesting and other agricultural commodities. The town of Leamington attempted to pass a bylaw that would prevent migrant farm workers from congregating in the downtown core. So the realities of racism experienced by these workers are apparent to all those who know of the program and do research on the program and the experience of migrant farm workers. The kind of anti-racism organizing that migrant farm worker advocacy organizations such as Justice for Migrant Workers, the Migrant Workers Network, Migrant Workers Alliance, engage in is really essential. And I think all we can do as far as pushing forward an agenda in which all migrant farm workers are treated with respect and dignity is through supporting those organizations and calling on governments to take into consideration and to address the racism that migrant farm workers experience on farm and in community.
I completely agree with what Simon said, and I think this is why education has to be put a little bit more also in the media. It's interesting because researchers, when we apply for grants and all that, we have now to obey by equity, diversity, and inclusion. Unfortunately, this is only in universities, and I think that's something that we need to really bring to the community. And I think a big part is because they do not understand the importance of having these skilled workers, and also the fear that, you know, I've heard at one point, oh, they are taking our jobs. And as the person, I said, well, would you like to go and work on the farm? Said, oh no, it's too difficult. So they don't understand, you see, and that's another issue that we really need to deal with.
I have one more question, and this is for the two Caribbean presenters. A number of people have asked questions which I summarize in the following way. Have Caribbean governments done enough to protect their workers when they go abroad to Canada? And if they have not done so, what recommendations would you make as to immediate actions which should be taken?
I'd like to take that up, Professor Bernal, and I'd like to segue from the previous question. There's something in Jamaican parlance that says, "Don't know who to frighten," meaning if we had a strong presence by the state in defending our farm workers, if we had strong advocacy groups, I think that the population in Canada and the advocacy groups in Canada would have a better leg, stronger leg to stand on. So that's the first thing. I think that the governments of the Caribbean, in particular Jamaica in this case, has not been, has dropped the ball in this particular situation. So the first thing they have to do is to not be defensive, but acknowledge that the ball was dropped. They were in a difficult situation, they were rushed, whatever the excuse is. We will understand this as a people, but we must now take up the responsibility for our migrant workers to communicate better with them. I am suggesting that a place like the University of the West Indies or other universities are in a very good position to pool together to create the kind of initiatives, advocacy initiatives that could help our persons. Right away, we can develop a small app which could contain a videotape on what needs to be done, what are their rights, find out what is happening with them on a regular basis, whether it's weekly or every 2 weeks. We find ways of communicating and just amplifying the voice of the migrant worker. It should not be coming through the media, the journalists, the advocates all the time, or it can come through them, but we must have somewhere in the Caribbean, namely, I'm suggesting UWI is a good place where the voices of the migrants could be heard on a regular basis, and we can feel their concerns refer them to the necessary organizations that are working in the Ministry of Labor, Ministry of Foreign Affairs. And I think this is relatively easy, relatively quick way through using Zoom or our different teleconferencing platforms to link with our workers and find out exactly what's happening, what are the immediate concerns, and find out from them about bottom-up approach to find out what their issues are. And I'll
Thank you.
to
Dr. Esnard, are you still with us?
Yes, thank you for the opportunity. I just want to add to what Dr. Brown spoke of earlier, and I think very easily we could develop a policy initiative from a Caribbean perspective based on the recommendations and the research and recommendations of a team, multidisciplinary team, and I would suggest a team that really covers the area of social work. I think Dr. Brown has done an excellent job of speaking into some immediate initiatives that we could use as part of this, but we need to understand the multi-layered levels of analyses that are required in something to address a very complex situation such as this. And we have all of those complexities at the level of the state, the economy, and the individual, and they are deeper, and this is what I raised earlier, they are very much deeper fundamental systemic issues that need to be addressed. This is just like as if we say the icing on the cake. This COVID-19 has really, in a very direct way, exposed the vulnerabilities and exposed the endemic issues that are part and underlie what those seasonal workers are exposed to and what they confront when they leave and when they arrive. So most immediately, I think there's a call for regional governments to come together and really form a collaborative team, multidisciplinary team, and form action plans based on solid data that speak to those experiences and the issues and that go deep, not just to identify immediate initiatives, but to problem solve. And that requires a long-term initiative and agenda, but one that is based on providing solutions, not just for Jamaica or St. Vincent or Grenada, but for the entire region, because this affects both a region and this affects the relations between the region and Canada as well.
Thank you. It is unfortunately that time when we have used up all the time we have. We haven't answered all the questions, but we have provided a very insightful series of analyses. We have provided invaluable information, and we have pointed in the direction of policy recommendations. After all, the Canada Caribbean Institute has as its central purpose encouraging research which will produce policy recommendations that can enhance the relationship between Canada and the Caribbean and deal with issues of concern to the Caribbean, both at home and in Canada. If I could summarize, a number of points came out clearly. First of all, the program, which started in 1966, is essential to the functioning of the agricultural sector in Canada, to food security, and to the Canadian economy. Secondly, it is at the same time a very important program for the Caribbean. Many of these workers, it is the main source of earning for them for the entire year, and it provides valuable foreign exchange, employment, they support their families, etc. Thirdly, as well developed as the regulatory framework is in Canada, there seems to be a lot more which could be done, and many of the recommendations for improvements do not seem to require major legislative or financial investment and could be done fairly quickly. Fourth, it is clear that in the current situation, the workers from the Caribbean are in a situation of social, economic, and psychological vulnerability, and that more could be done by Caribbean governments to support their workers in terms of preparing them for the environment they're going to, keeping them informed, keeping them linked to their governments in the Caribbean. In that regard, let me say that there used to be for many years, several decades, a Caribbean liaison labor office in Washington, which used to handle the program in the United States. I'm sure that the embassies, high commissions, and consular offices of the Caribbean governments in Canada are in touch with the workers, and perhaps at some stage we could hear more about what they're actually doing. It is clear that there is room for more improvements, and as I said earlier, one of the functions of the Canada Caribbean Institute and of fora like this is to encourage that research and to focus that research on policy recommendations which can improve issues of mutual concern to Canadians and Caribbean people. Finally, it's incumbent on me to thank all of those who made this program possible. I had a germ of an idea and they took it and transformed it into a very important and interesting afternoon's discussion. I in particular want to thank Dr. Christine Marriott, Senior Program Officer of Global Affairs, University of the West Indies, and Dr. Camille Rutherford of Brock University. I thank all of the panelists for their presentations and for those who listened in, especially for those who sent in questions. We still have a few we haven't answered, but we just didn't have enough time. We will share them with the presenters and ask them to respond. So thank you all very much.